Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. So our goal today is going to make the plan for ourselves. So now that we know all these things, we want to put it into action. So I want you to be thinking about how you're going to be determining your center, your provider, what kind of questions to ask, how to make a plan for your treatment, how to make a plan for your self-care, all those kind of things we're going to go into today. All right, so get your paper and pen out, and let's get cooking. When you got your diagnosis, you may still be with your primary care. So how do you think about your center and your provider? What are the kind of questions you may want to think about as you are deciding your team? Because it's really important to have a good team to support you, that you feel good about, so that you feel good about the treatment that you are getting, and you feel comfortable with the team, with the center. So what are some of the questions to think about? So let's touch on that. You'll want to go through this and make a note for yourself and make it like a checklist, so you can check off, yes, I'm okay with this, this is checked off, this is checked off, I'm fine with the center. When you're looking for a cancer center, you'll want to check if the center is accredited. The body that accredits is the Joint Commission or the Commission of Cancer on Cancer, or National Cancer Institute. So when you are looking at the centers around you, you can look at, is this cancer center or clinic accredited center? Also, because you'll be traveling to that center, think about the location. Is the location convenient for you? Will you be able to get there? Will somebody be able to take you there? Also, you'll want to see what is the specialty of the clinical team. For example, if you're going there for Hodgkin's lymphoma, then is the clinical team there experienced in that cancer? Do they see a lot of patients with that kind of with your kind of cancer? Do you feel comfortable about it? Based on the kind of treatment that would be best for you, do they have the right technology for it? Is the facility itself clean, well maintained? Any risk of infection, anything like that? You'll want to walk around and you feel comfortable. Most sites, most good cancer centers are keeping all these things in mind. So they do have good technology and the staff is trained, they have good facility, they're trying to maintain risk control. So most centers are. It's so for you to go through and feel comfortable and see that the site matches your standard. Also, if you're thinking about clinical trials, then you can see if the site has access to clinical trials and how you can find out about them, how you can access them. Okay, so I've listed here websites for you on where you can go to check if the centers are accredited with these three bodies: Commission on Cancer, National Cancer Institute, and Joint Commission. All right, so if you need to, you can pause the video here and make a note of this link and check out your center. Now, when you are selecting your oncologist or your clinical team, some things to think about is what is their experience with your type of cancer? How many patients have they taken care of? How long have they been in that area? What is their education in this particular area? Are they board certified or have a specialty certificate in that particular area? What hospitals are they associated with? So just so you feel comfortable. Also, do you feel comfortable with them as a human being, with their clinical style, with the way they think, with the way they perceive things, with their bedside manner? Just make sure you feel comfortable with that oncologist, with their medical team, because this is going to be a close relationship for you. So you want to feel comfortable about the decision you have made. Also, you'll want to check your health plan. If this particular oncologist, if this clinical team is covered under your health plan, because sometimes it's possible that the center is covered, but the particular oncologist or the particular radiologist is not covered. So that's something you will want to check with them if they can help you, or you can check with your health plan, call them and check if they are considered in network or not, so you don't have any unpleasant surprises later. Now, here are some sites on where you can find medical providers in your area. There are other sites as well. Also, I suggest you can look up reviews about the center and about your medical team. So you can see what other people have said. You can see stories from other individuals and see what they're saying. You can join. Many of these organizations have community groups like Facebook pages and other communities. So you can join those and see what was the experience for other people. And that way you can make a decision about which center you want to go to. Next, I want you to think about these questions and work through it for yourself, okay? Also, there is a workbook that's associated with this. For the questions, you can ask your oncologist, so you can mail us if you would like that book, and we'll make it available for you. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell, so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.